Okay, hi, I'm Brooklyn.
I'm Abby.
And I'm Natalie.
We're going to be talking about electronic health records with you guys, and I'm going to start it off with hardware and software. So some basic hardware terms would be like a workstation, which would be a place where you can like where the computers are at or something like that, where you can work at like a certain station in like your nursing unit. A desktop, one of the three basic types of workstations. This describes a fixed hardwired computer that does not move around. The computer can actually sit on the top of the desk or on the floor or tower. There's a laptop, one of the three basic workstations as well. This is a portable computer that has a keyboard and either a touchpad, which we all have laptops. Here's examples of them. A tablet, which is just like a little tablet that you can carry around with you. We use them a lot in our nursing simulations and stuff. So those are just little examples of hardware. And then software, it's like the electronic medical record that we actually have, like the systems that we use. So some examples of them would be like the eClinicalWorks or Allscripts or Epic, or we use Meditech at Adena, just different types of softwares that we can use to put our patients' information in.
So some examples of the patient information that she's talking about would be called data elements. So data elements are things about the patient that's important for the nurses and the doctors to know, such as their date of birth, their gender, their height and weight and demographics, and just like all of their information at staying at the hospital. Security considerations. So every patient is covered under HIPAA. So every EHR security framework should be multi-layered. Securing endpoints is an important consideration, and a combination of internal and external auditing applications should be used, as well as examining the audit reports.
I'm going to talk to you about some of the benefits and disadvantages of an electronic health record. So some benefits are easy access to general patient information, such as their medical history, their immunization record, lab data, and from physician to physician, you no longer have to send hard copies of the information, so that saves some time and effort. Also, there's the elimination of poor penmanship from physicians, which has historically been a problem. You no longer have to call the doctor to clarify an order, so the orders are a lot more reliable. The electronic health records have been linked to an increase in evidence-based clinical guidelines and effective care due to the CDS tool that are in EHRs. So the CDS tool assists the provider in making decisions about patient care. They also alert the provider when immunizations are due, so that's another cool feature of it. EHRs have led to a decrease in wasted resources such as supplies and equipment. They've also reduced med errors due to having to scan the patient wristband, scanning all your medications, and it just makes sure you do all of your 3 checks of med administration. And the last benefit is patient data is more available due to it being stored electronically, so there's an improved ability to conduct research. And then with these benefits, there are also some concerns with electronic health records. So there's an increased cost from purchasing and installing hardware and software, and then also you have to take the time to train users. Also, there's maintenance of EHR, which is costly, and there's a lot of upgrades that have to be done yearly, and you also have to train your employees again on that. There's also risk of patient privacy violations. So being an RN, you can go into your computer and access pretty much any patient that you want to, but you really should only be looking at the charts of patients that you're assigned to. So hospitals are trying to control this by creating penalties to employees that inappropriately access files. And another concern is that there is an over-dependence on technology. So during system downtime, the healthcare team doesn't really know what to do, and they're not able to do their job effectively since they're so reliant on technology. So that's all we have for you today, and we hope you learned a little something about electronic health records. Thank you for watching.
Bye.